Fatty liver sounds simple, but it can silently lead to serious liver damage if ignored. So, what is it really? Fatty liver means extra fat builds up in your liver cells. Normally, your liver processes nutrients and filters toxins, but when it gets overloaded with fat, it starts to struggle. There are two main types. Number 1, alcoholic fatty liver from heavy drinking. Number 2, non-alcoholic fatty liver disease linked to obesity, diabetes, and poor diet. The scary part? Most people don't feel any symptoms, but over time it can cause liver inflammation, scarring, fibrosis, and even cirrhosis. The good news? It's reversible, especially in early stages. Here's how to fight back. Lose weight. Just 5 to 10% weight loss can reduce liver fat. Cut out added sugar and refined carbs. Eat more whole foods and healthy fats, like olive oil. Exercise regularly. Even walking helps. Limit alcohol or quit completely if alcohol is the cause. There's no magic pill for fatty liver, but lifestyle is powerful medicine. With consistent changes, many people see improvement within months. If your doctor says you have fatty liver, don't panic. Take action. Your liver can heal, and you don't need a perfect diet, just progress. If you found this helpful, hit like and subscribe for more medical animations.